Welcome to the Gut Show. I'm Erin Judge, registered dietitian and founder of Gutivate, and I will be your host. My goal on this side of the internet is to empower those with IBS and digestive disorders to understand their guts better, to have a healthier relationship with their bodies, and make confident choices to improve their digestive health. During this season of the Gut Show, you can expect a weekly conversation covering a hot topic related to health, digestion, and IBS. As a disclaimer, I am a dietitian, but I'm not your personal dietitian. Everything we cover in this episode is meant to be educational and not a substitute for personalized care from your healthcare team. Are you looking for science-backed holistic care for IBS all at your fingertips? If so, the Master Method membership is for you. I get it. I've been in your shoes, dealing with symptoms every single day, accepting them as normal, but knowing there's gotta be more than this. Maybe you find yourself searching through Google and social media and trying all of these isolated tips to figure out what is the secret to your symptoms, only to end up more frustrated and completely stuck. Something that I've learned as someone who lived with IBS myself, but also in over half a decade of experience working in IBS, is that oftentimes people miss the holistic approach to managing their symptoms, meaning they focus on one isolated thing versus focusing on the full puzzle to get true results and sustainable results. The Master Method membership was created to help solve this problem by walking you through one step at a time, by guiding you through how to put this puzzle together for your body. Not only will you learn what's causing your symptoms and how to keep assessing what's going on in your body, you will also learn how to manage your symptoms, how to support your overall health with nutrition, and even how to change different habits and things in your life to give you more energy, more flexibility, and a higher quality of life. Not only that, but you also will be able to connect to other members in the membership through Club MM, our private community. So if you are interested in getting control and getting guidance right now, then go to the link in show notes to join the membership. Kelly, thank you so much for being here. You've been my personal PT, so I'm excited to share some of the things that you've always shared with me, with my entire community. So I appreciate you coming on.
Thank you. I'm excited to be here.
Yeah. So before we get started, I'd love for you to tell everybody a little bit more about what this pelvic floor physical therapy actually means, because I know that that's an area that's of a bit of confusion in the IBS world. So would you mind sharing what pelvic floor physical therapy is, and then how that may relate to IBS treatment?
Okay, so this is like a big soapbox. So we'll see which tangent I end up going on. Pelvic floor physical therapy is a subspecialty, I consider, of orthopedics, and orthopedics meaning anything related to the spine, the muscles, the tendons, the bones, the joints. What I like to look at, and there's a few different ways to think because my background is as an orthopedic clinical specialist, is pelvic floor PT is looking at the realm and the region from the inside as well as the outside. So looking at the hips, looking at the spine, looking at the diaphragm, the abdominals, and then pelvic floor are groups of muscles, or is a group of muscles that lives in the pelvis. And the pelvis is just the bony anatomy that holds your bottom half to the top. What this specialty has brought to my attention, aside from kind of what I came out of school learning, is that this area houses a lot of things. So kind of going back to your question, general orthopedics is bone, muscle, tendon, nerve, soft tissue, joint. When we're talking pelvic floor, we're talking endocrine, we're talking reproductive, we're talking GI, GU, neurological, and then we got the integumentary. Like, we have so many systems that run in and through this region that things can really go really well or things cannot go well. Going back to the IBS, we also know that this part of the system is very sensitized by what goes on neurologically, the way we think and the way we move or don't move, and to the demise that sometimes we don't even know what's going on until we see symptoms. And for people, symptoms within my world is anything from shortness of breath, they can't move well to breathe, and we'll probably go into more of that today. Overengaging abs, so those upper abs, if those are overengaged because the body's trying to compensate, specifically my world is a lot of postpartum. So the body's going to do what it needs to do a task. The easiest way and the least resistance is what it typically does. So a lot of compression we see is through the upper abs, which puts pressure through the GI system, through the pelvic floor, and aggravates some of that nervous system that helps the GI system do its job, that vagus nerve. And then I find just a lot of like tension through the hips too. So there's a lot of things that we look at. That was a very long answer, but looking at the body from a very big view, and then trying to come back and seeing what symptoms you present with, and then what are the other things feeding in, because it's not always just at that area. Usually there's a lot of other factors. You talk a lot about sleep and diet, and I know your world is big into stress management. And so it's like the habitual things and the behavior modification and all that are what we really talk about, because nobody else is touching on it, right? Like we get to spend an hour with people. The doctor is going to say, here's a med. Well, meds don't fix stress. Meds don't fix bad habits of poor sleep.
Yeah.
Or
muscle dysfunction. I love your perspective on that and how you phrased all of that, because I think a lot of times when we talk about pelvic floor physical therapy, sometimes we often focus so much just on pelvic floor muscles. And so we're just looking at those openings, right? So in postpartum care, that's always talked about. And then from an IBS standpoint, like, looking at all the muscles around the rectum and how those are properly, coordinating and releasing, which I know is a huge part of what you do. But I think the understanding that pelvic floor physical therapy, or looking at the role of physical therapy in your digestion symptoms, goes beyond what's happening at that opening. It's also about your hips, about your movement, about your flexibility, about your mobility, about your breath. Like there's so much that could be going on that could be interfering with the way that the digestive system is working. And I know I've heard a lot of people say, well, I got an anal rectal manometry exam from the doctor, and they said I don't have pelvic floor dysfunction. And so, or I don't meet all the symptoms, right? I don't have chronic pelvic pain. And so why would I go see a physical therapist? Like, I'm not sure it could help me. What are some of the cases that you've seen in your practice where that's the case, where maybe it's not true pelvic floor dysfunction, but there could also be pieces that you can work on with a patient that would help diarrhea, constipation, chronic bloating, all of these symptoms we see?
All the gut stuff. Yeah. So I think that, I'm trying to think of a couple of people specifically. The gut is housed between the diaphragm and the pelvic floor. And so I find a ton of patients with hip dysplasia or like chronic hip tightness. And I've even had people with old knee injuries and foot and ankle stuff.
That's me.
How you walk is going to change how your pelvis moves, is going to change the neurology to the GI system and the pelvic floor that lives within it. So going back to what you said, and I didn't touch on it, the muscles in the pelvic floor have to be strong. They have to be coordinated. They have to be able to lengthen to allow something to pass out with a bowel movement or in with intercourse and intimacy. And so anything along that whole chain can affect your big toe, can affect how you walk, can affect how that pelvis is moving, and can kind of affect what the GI system is responding to.
Yep.
I'm trying to think of a particular patient, but I have a patient right now that I'm thinking of who had a colectomy, and we were working on pelvic floor to the point where she could not, her goal, she had a bunch of other stuff on, but her goal when I got her was to be able to have intercourse with her husband. He's military, and he was heading out of town, and she's like, I just need to be able to enjoy my marriage.
Yeah.
We got that better, but we still have bowel stuff. But I think because of her general condition, the pelvic floor for her was not the problem. Hers was nutrition, and the bowels there was no large intestine to give her some of the nutrients that it generally absorbs. So we got pelvic floor moving. They ended up having to do another surgery and reversed it. She was doing fantastic, but that all goes back to pelvic floor is a piece of the puzzle. Her manometry was fine, but her sacrum was so stuck because she was in this anterior position, which put more pressure on belly and put more pressure on hips, more pressure on pelvic floor neurology in terms of that pudendal nerve and some of those other things that talk.
Yeah.
So in her case, pelvic floor did a good job. opening and closing, and she could have a bowel movement. So that wasn't her piece of the puzzle. It was for her, it was her digestion. So we kind of ruled off musculoskeletal, which a lot of people don't have that opportunity to.
And even if that does get rolled out, I mean, you mentioned there is still so much more that you can do, right? Because there are all of these pieces that fit together. And even if we don't necessarily solve all the digestion symptoms with, the pelvic floor piece, we may improve the ability to move and exercise, which then can lead into down the road. Or joy, right? Of, intimacy. That's a huge one. Being able to just feel that kind of even better connection to your body. So you mentioned that tension, and we're going to get into diaphragm. So we're not going to hone in too much on just the downside of the pelvic floor as much, but even thinking about tension, I think that's something that is so often missed because we see, in our society, we're taught to suck in, pull everything in. And those who are bloated often will try to pull everything in, wear tight pants. You're sitting at a chair, you're sucking in. And a lot of people don't understand that sometimes their bloating and even their pain and discomfort can be related to that, even just that sensation of holding everything.
And it's that cycle of tension creates pain, creates decreased motility, creates gut. You made a Instagram post on gas. Well, gas creates pain, which is going to create more tension. And then you're stuck in that cycle. And then we get that neurology of, oh my gosh, here we go again. I'm going to miss this, or I'm going to have to find a bathroom, or, we get some of those negative thought processes for good reason. Your brain recognizes it as something it's not favorable, but finding a way to move and learn how to move and getting somebody in your box can kind of help you change those sensations your brain is recognizing, but also change how things move to take pressure off the GI system and pressure off pelvic floor. Absolutely are significant in our world too.
Oh, absolutely. And it's like something that, everyone who's listening that's like, okay, the medications aren't working, or I'm doing all these diet eliminations and I feel like I'm doing all the stress management, I'm clicking all the boxes. Sometimes it is simply the foundations of how your body is meant to function. And we're not meant to just sit tight all day or have chronic tension, and our bodies are meant to be mobile, which, we talked about in a lot of my care. I hold a lot of tension. I've had chronic constipation since I was a child. And there's probably a lot of layers to that, but I sit often. I have a lot of stress. I pull it all in. And you see that manifested in your body. And I could do all the other things right, but if I'm not spending a little extra attention to those things, I might be more bloated. I may have more symptoms that pop up, out of nowhere whenever there really is a reason. So I think it's a good perspective to think about with thinking about, okay, how could this fit into your toolkit? And also thinking about, people who come in, and again, we're about to get to diaphragm, but I know a lot of people listening may also say, well, I've tried pelvic floor physical therapy and it didn't work. It's like, not all physical therapists are the same, just like no all practitioners are the same. Maybe you went to a general physical therapist as well, no shame. But thinking about your care, you want to make sure whoever you're working with is also looking outside of the box a bit and looking at your whole body, your whole movement, and even you bringing that into your care. If you have back pain, communicate it. If you notice that you pull a hip or you tore a hamstring, or all these little things that may seem disconnected actually could be really connected. And so making sure your whole team knows about it, especially when you're doing physical therapy, is so important. I think so many people miss it. Pain with sex is number one, right? It's number one where no one talks about it. And it could be that one link that's like, if you just mention that, you might actually get better care.
And in our world, there's no TMI. It's only as awkward as you make it, right? And it makes sense. If you have bowel dysfunction, intercourse and intimacy is like that. Your body is not, when we talk about the nervous system, you got your parasympathetic, which allows the guts to do their job and allows for intimacy. But if you're in that sympathetic drive, if everything is on, our brain is running from the bear all the time. Intimacy is not going to let you run from that bear. So learning how to get out of that sympathetic drive is super important. And some of the techniques that a skilled or knowledgeable PT can do to kind of get that plexus a little bit happier and get that nervous system a little bit of downregulated can go a long way. But I think understanding that too, and giving you those tools, and not getting stuck on the, oh well, this didn't work. Okay, we'll check that off your list, and let's move on to something else. Sometimes it's a cascade of of right things, just like there's a cascade of wrong things that got you to that place. I think my comment originally was going to be an incident a decade or 2 or 3 ago, a fall on the tailbone, a pretty significant tear with childbirth, something traumatic that happened as a child. All these things do manifest to a degree. It's just a matter of how much your body and brain processes it and when and where. And so kind of going back, if things aren't getting better, how many other people can we pull into your corner so that we can hit you from all aspects and make sure we're not missing any piece of your system?
Absolutely. Absolutely. All right. So we're kind of going to go a little bit deeper here and hone in on the diaphragm because, I feel like pelvic floor gets a lot of attention, and the diaphragm typically only gets attention when it comes to breathing and like hypnotherapy and that kind of stuff. And so I want to go deeper to understand this better. First off, what is the diaphragm and where is it at?
The diaphragm is your breathing muscle. So it lives within the rib cage, on the bottom of the rib cage, and it attaches to your thoracolumbar junction. So it's the bottom of your mid back. So its main job, when it activates, is to descend, which makes your belly rise, ribs expand, and then on the exhalation, it just naturally kind of recoils back. And we can use breathing in several different ways. And it is what kind of has fascinated me with the diaphragm is it's subconscious, like it works all the time, but we have access to consciously facilitate it. So it's one of the muscles in our body that just is going to work when we want to, kind of like blinking to a degree, but we also have full voluntary control over it should we choose to consciously work on it. And then we can use that to our benefit for stimulating that nervous system and helping find stability or create stability through the system or turn it off too.
Awesome. So it helps with deeper breath and like healthy breath, if you will, calming the nervous system. And then we know that a calm nervous system helps with digestion. Are there other ways that the diaphragm directly is involved in digestion or plays a role?
So the diaphragm also is involved with breathing, as we know. The lymphatics pump through the back of it. There's a thoracic duct, and through the back of it also come that vagus nerve. So its involvement is also with the psoas. So if you're familiar with that muscle, so kind of going back to sitting, if we're sitting in a flex position all the time, that psoas muscle attaches from the diaphragm, the T12, all the way down to the anterior hip. And I can get my little book if you want me to, because I'm a nerd. I'll show you my poster. But when that muscle can get tight, it can restrict that diaphragm distension or excursion. So the diaphragm does help with breathing, but it also, when we tap into it, helps with that kind of muscle mobility too. They kind of slide and glide on each other.
And then before we talk about what goes wrong with it, let's talk about that first, actually, before we get into the IBS connection and some theories that are floating around. But the diaphragm you mentioned it's happening anyways, right? And then we're able to utilize it for relaxation. We're able to maybe strengthen it, make it better, tap into it in a better way. It seems like with that in mind, it shouldn't ever go wrong. It should just be working perfectly. So with all the things we've already talked about, when does the diaphragm not work properly?
When we get stuck in this position. So our diaphragm is our prime breathing muscle. What I often find is with pain, we go into that shallow breathing, which utilizes your accessory respiratory muscles. And then we start breathing more apically, which reduces that mobility and the visceral mobilization that natural breathing actually does on a daily. We breathe 22 to 24,000 times a day. So I hate saying incorrectly, but if we're breathing suboptimally, you're feeding into that nervous system. The scalene, there's a group of 3 muscles. The scalene runs up and attaches to C2. There's a huge group of that. And that's also where the vagus kind of runs down and through. So there's a huge component in cervical spine, kind of going back to out of the box. Where's your head positioned and jaw? My jaw clenchers. We can go way back to like your oral cavity is finished in utero by day 26. So there's a huge, and scleroderms and some of this other histology, I guess. But the oral cavity and the jaw and the neck play a huge role with how you breathe and how you myofunctional therapy, if you're familiar with that. That's a little bit out of this. I don't know much about it, but how you move your head and your jaw can play a significant role with sleep and all the other cascade of things. But going back, when that diaphragm does not move well, when we go back to that apical breathing, feeds further into that stress, feeds further into headaches and neck pain and jaw pain, which once again, now we're in that pain spasm cycle. And anytime you're there, that completely decreases the motility and decreases some of that good old digestive processing.
Yeah. So like not fully activating it or being restricted because of other tension. Are you really fed up with your IBS symptoms controlling your life? Are you frustrated with feeling like you're going in circles day in and day out, and you seem to try things on your own? You're taking in all the information, but you're still finding yourself stuck. If that's you, I invite you to join the Master Method membership. This is a science-backed holistic program for IBS that we've developed with you in mind. It covers what to do to support digestion, how to support the drivers of IBS, including gut-brain connection, your microbiome, altered motility, and even altered immune activation. We also talk about how to support your nutrition and your overall health through your diet, with a focus on what to actually add to your diet versus only what to take away. And we guide you through all 3 steps of the low FODMAP diet process in many different ways if you want to use that evidence-based tool for IBS. This program has been proven to work with many with IBS because it truly does approach health and well-being from a whole body perspective, while also targeting IBS specifically. So if you're ready to get guidance so that you can take control of your symptoms, join a community of others who are working on their IBS and ready to connect with those who get it, and lifestyle resources to help you every step of the way, then join the membership today at the link in show notes. And then beneath the diaphragm, so this is going to feed into my next IBS question specifically, the diaphragm, because it goes down, so right, because it pulls down, it expands down towards the base of our core, so towards our belly, if you will. And so whenever we're breathing, the diaphragm expanding also helps expand through the rib cage, and like, you feel it through your belly. And if you're ever taught diaphragmatic breathing, that's what we teach, right? Is to fill and expand your entire abdomen. Looking at tension in the lower abdomen, so hip tension kind of at the base of that chain, or what you mentioned before, like either holding tension in your core or maybe weakness through the core. Can that weakness and tension restrict the diaphragm itself, or is it that the diaphragm not being fully utilized is contributing to the tension? Does that question make sense?
Probably a little of both. So I'll start with the weakness piece. So a lot of people are taught belly breathing, which is where kind of we're doing too much anterior breath and not that lateral excursion. And that, if you have diastasis or belly, kind of the bloating stuff or the pooch or whatever other terminology you want to call it, that feeds into that. And what I also see is when you are breathing more in the belly, once again, those ribs are not utilized. We should have about 2 inches of excursion through that rib. It should be like a little bucket handle. So you may be breathing down, but it's more of an anterior instead of a full broad spinal breath. And that can feed into weakening structures that may be a little less than ideal. But once again, the body's going to do something it needs to do. So if we're weaker in the front, something has to compensate. And usually I find that lower mid back, like right at the bottom of the rib cage, it's almost like we seesaw breath, so that we expand through the front and jam that back together. So the paraspinals are helping you breathe instead of that diaphragm. I don't know if you can follow my fingers and my words. So now that leads to tension to the thoracic spine because your paraspinals, your back muscles are helping you breathe instead of the diaphragm. And you're kind of weakening or creating more tension in a space that if you do have a diastasis or a weaker core or poor pressure management, which is what I like to call it rather than, I don't know, some of these words out there I feel like are so negative and not like giving nocebo words, but then we're feeding into that. So kind of going back to pelvic floor too, if we're breathing always anteriorly, air may not be getting down into those lower abs or even to the pelvic floor. And some of that is just because we've never been trained or taught otherwise, because once again, body's going to do what's least resisted and is easiest on it. And so I mean, positioning, you can position yourself where you're biasing some of those spots, but it really goes back to the mindful piece of like, where am I breathing?
Yeah.
Are my neck muscles helping? And can I breathe in those right spaces?
Mm-hmm.
So
Yeah,
a little bit
you've
about
always taught me whenever we've worked on this too, of like thinking less about your belly getting bigger, but thinking more about like the sides between like your rib cage and your hips getting longer. So kind of thinking about finding space there as well, and kind of helping kind of rethink that
I
connection.
like the umbrella analogy, because
Yeah.
then it's like a 360 breath. That's probably more what we talk about now rather than belly breathing, because belly really just, it's only a third or a quarter of what we need access to. But it also depends on what your brain and body need. Like, what are the cues that give me the best? I have some people, I'm like, breathe into your butt, breathe into your sit bones, breathe into your pubic bone, breathe into my hands. Like, I'll just give them that feedback. And I find a lot of people need that palpation, that grip, that hold, because we don't know. There's been pain. So we kind of dissociate from an area that we feel not in control of. So giving yourself a hug through those rib cage, through that bottom of that rib cage, and then thinking about broadening that breath, exactly like you said, using a band, being on your side, being in a stretch position that biases, that are all great ways to just kind of do some self checks. And I can throw a video together and you can send to your folks on some of my favorite tips. But a lot of it's that mindful piece of like, right now I'm slouching. So where's my pressure going? Down or back, and not broad through, or I'm holding myself with my hip flexors instead of letting my abs do the work. Tight hip flexors pull you into that position, which jam the back, which, it's just it's
like back to the cycle.
What are your patterns? And let's figure out how to get out of those biomechanical patterns to help the psychosocial patterns to help everything slide and glide out where it's supposed to be.
It's kind of, I always call it like the messy web, that everything is so interconnected that it feels so messy. And even like listening to this, right, it's easy to think, oh my gosh, like there's so many things. But the truth is, untangling that web is actually not as complicated as it seems like it should be. It's just making sure we're addressing all those connection points so that we can easily untangle it. And just to kind of review, thinking about, okay, if you're activating your diaphragm properly, one, you're going to help your body relax, which again is where we talk about it the most. Doing that before meals helps your body digest better. It helps your gut calm down. You're going to help release tension, especially in your abdomen and in your pelvis. That can help reduce pain. That can help stimulate motility better because that restriction is gone. And so there's these things that people kind of forget of like, oh yeah, I just need to relax. Like, no, there's so much more that's involved. So I want to go into two major pieces here. One is abdominophrenic dyssynergia, APD. That is, something that I feel like is sort of gaining more attention. It's a condition where there's a diaphragm dysfunction. You can tell, we can talk about that in a little bit. But when we're looking at patients who are bloated without really excess gas, without upper GI, like no GERD or reflux, but they're dealing with this kind of pregnant belly bloat that doesn't seem to fit the boxes of things like SIBO or even just IBS, we've learned about this abdominophrenic dyssynergia problem. Can you speak a little bit to what that actually is?
That is something I'll have to do some more research on. It actually came up recently in a conversation. I honestly don't have a black and white explanation for that besides knowing the anatomy. The phrenic nerve once again runs through that C2 and down into the abdomen. But if you're not breathing appropriately and you're not gaining that full access to everything, then it limits and it can decrease just once again kind of that motility through everything. And we see some musculoskeletal pieces because of a neural disconnect.
Yeah, absolutely. I think we need so much more research on this because I have found that it's a complicated thing that we know kind of exists, but also it's not really researched or even talked about. So even the diagnosis of it can be really challenging. And it leans into the newest theory in IBS where gravity may be playing a role in symptoms. It's this theory that came out, I think last year or the year before, where everyone was like, okay, is gravity the cause of IBS? And the whole theory is that the abdominal wall isn't properly, I'm going to try to say this so that you can better explain it from a physiological standpoint, but the abdominal wall isn't properly holding or kind of reacting against the diaphragm, as well as that change in distension with the abdominal wall. So thinking about like when you eat, your stomach expands, and then as you digest your food, your intestines expand as that food comes in. Like that's very normal and should happen. But your abdominal wall should kind of counteract it a little bit so that you're not fully distended all day long, like in getting distended to the point where you look pregnant. There should be some sort of a rebound that then supports digestion. And so there's that theory that if you're not having that proper rebound due to laying down all day, maybe that I like the word weakness is my best word for it, but just not proper coordination,
like
not
inhibited almost, like it just doesn't fire at the right timing, it sounds like. Or just reciprocate. It should give you that little bit of backing, or natural tone should be present, and it's almost like it's undershooting, huh?
Yeah. Does that make sense? And I think it most relates to possibly even like diastasis recti, right? Where we have that the muscles they're not coordinated properly, right? There's
that
a
tension
dysfunction
across them is less than ideal.
Yeah. And so it leads to that pooch that you mentioned, where it's like, oh, okay, it looks you can see it visibly whenever you shouldn't be able to, right? There should be somewhat of a coordination back together, or again, that holding, because your core is meant to hold everything in place. And so I think it's probably related to that. Again, research is very much more in a theory standpoint, not in a causative standpoint, but I feel like that relates to a lot of the things that you've just talked about too, of not just the tension of like, oh, everything's tight, but also like, well, could there be a lack of rebound because of tension, because of maybe improper training, because of improper care, throughout medical history, poor movement, all these things that could be playing a role. I don't know. What do you think about that?
And that may be why there's not much, where PT is very researched and evidence-based. And I have a gentleman that actually I'm thinking of right now that he threw that at me, and I was like, I'm just being blunt. I'm like, I really don't know what to do with that besides let's train the TA, let's get pelvic aligned, let's get psoas turned off, let's work on nerves so that we're breathing better. But his biggest complaint was, I feel like I cannot take a deep breath. And so the question there is, well, is he already stuck in inhalation? Like, is he already mechanically in a position where he just can't go into more of that excursion? And how do we turn that off? And I'm excited that your world is talking about this, because I haven't been exposed to a ton, just being very blunt. And maybe that'll be my next nerdy dive into some more research. If this is that common, then obviously we need providers helping everybody figure out.
Oh yeah, absolutely. And we definitely need more research. I think, even looking at the papers and the articles that came out and the study was very much looking at past data, and they were looking at people who were more bedbound for long periods of time in the development of IBS. There was an extra look at like adipose tissue in the abdomen. And so looking at that side of things and like the weight. And so not even just the poor rebound, but also extra weight on the abdomen, maybe pulling down or creating that extra tension, which we know isn't just the weight problem. It's also probably the weakness of the whole body to support that. And right now the theories or the kind of proof that they gave was like tilt table tests. So putting someone in kind of an upside down type of position and noticing that their pain and their symptoms felt better. Which isn't really a true treatment, because it's like, well, that's not, you can't just be upside down all day or blood flow,
But can we, so is there too much tension, and can we invert a little bit? But once again, that's going to upset upper GI. So how do you help? You don't want to ever stick somebody upside down and invert after you've just eaten. I don't know. I do a lot of like pelvic inversion where you're just putting the ball on the butt and opening that lumbosacral spine. But I don't know if that would translate to the complete inversion of the cardiovascular system. And going back, is it a cardiovascular thing? Like, is there blood flow? What's the iliac? What are those little arteries off the aorta doing? Are they that mesenteric artery that talks to small intestine and all those, like, is the perfusion good? Is it not good? Like, so I would be curious. And where there's arteries, there's nerves. So how do we, how do we make everything happy? And I don't know.
Yeah, we don't know. Yeah, I always say, we could cut you open and we still may not know fully, which is probably the hardest thing with, any of these symptoms. When we look at endometriosis, when we look at, IBS, when we look at just even chronic constipation, diarrhea, neurological conditions, our muscle, like Ehlers-Danlos, and even our POTS people, there's a lot of unknown, and there's also just a lot of trial and error that is needed. But looking at that whole body, and I think that some of the theories, even APD, we see it and it's like, well, the treatment is learning how to coordinate the diaphragm again, which is what you're already doing, and then strengthening the abdomen, possibly reducing tension in another place. It's everything that you just said, right? And it always comes back to, okay, how is the whole body being supported? And then can we not just theorize, but also look at your body and your movement to see if there's something that we can do. Just like from a diet perspective, it's not helpful if I say everybody should eat, apples every day. It's like, no, it's more helpful to like look at what you're currently eating, figuring out where there's patterns, correlations, what you have available to you, and then how we can expand that in a way that works, that then lines up with the research without it just being like, here's the recommendation with, no assessment involved.
Right. And it's, it's that conversation of what are you doing? What are you not doing? What have you tried? And so, by the time I feel like people come to us, and maybe even you, they've tried so many things that their system is just so heightened that it may take a while to like keep digging and pulling the pieces. A while, it could be a year or two. We've been thrown antibiotics that messes up your microbiome, and that could mess up vaginal microbiome, like it, which is going to mess up pelvic floor, which is going to mess up the GGI, which is going to mess up, like, it's just, I don't know. Lots of layers, but it's simple treatment if we can kind of step back and say, we're going to start here. And there's usually a pattern that most of us in our world see, in your world too, of let's start with the most common treatments and the most common things that every human needs. And then let's get real specific and find out what you have or have not, attacked or tried to mediate.
Absolutely. So kind of leaving our audience with one major takeaway, because you mentioned a really great point, and like all of this kind of comes back to the same point, is if your body is in this kind of overdrive, if you're in this stress state, it's easy for us to say, just relax, just breathe, just do meditation. And yes, those are fantastic tools like self-care, meditation, breathing. But you've talked a lot about like physical ways to actually turn down the nervous system. So I'd love for you to just kind of break that back down into, okay, someone's feeling like, I feel like my whole body is just in a state of tension. I'm in fight or flight. I know it. And I'm trying to do these other things, but my brain is not even connecting. What are some of the physical things that someone could do starting today to help start releasing that tension?
I think I'd say if you came in day one, my first one or two things would be probably that child's pose position, or a position of where you're open, letting belly be soft and saggy, and letting it relax while you're breathing and taking those deep inhalation breaths with a slow exhalation. So working on finding that coordination, and then really thinking like, where am I feeling this? What am I feeling? Soften the neck, soften the collarbones, get those ribs moving, let the belly move. And I have some people, I'm like, go through some scanning, like what got you to that point? And then color relaxation. I have a lot of people, I'm like, find your color. And then breathe it in and kind of breathe it into all of your little spaces. So child's pose is one of my favorite. Even just side body breathing is one of my favorite. But I love flat laying, legs up the wall, pelvic tuck, where you've got a ball or a towel roll under your pelvis, giving your back that openness where you are grounded, you are feeling your parts on the floor and, checking to see where's my head, where's my chest. Pelvis is up, so it's going to allow that gravity to pull everything back up and in, take pressure off the belly, which usually feels fabulous, pressure off pelvic floor, sacrum's in a supported position, which is the tailbone between your butt cheeks, and then spine's in a neutral position. And I think just laying there for a couple of minutes, If you can't lay there and be still, go get some sunshine, go for a walk, go do something that makes you happy, get out of your mind, go play with your kids, go to a ball, like do something that you kind of enjoy, because usually we're in that state of, oh my gosh, here we go again. And we really just don't let ourselves enjoy the immediate thing at hand. But the breathing is huge. I love the feet up the wall position or feet over the couch, like that 90-90, where you're fully supporting your butt, your back's on the floor, and you're just kind of grounding yourself without being super woo woo, but giving yourself that, just be still and let me breathe and let me calm down and I'm going to be fine. Yeah. Finding those affirmations, finding those, figure out what caused it. Usually there's something. Just give yourself that half a second to be like, this is okay. I've been here before. I've gotten out of it. We're going to be fine. This is a small flare up. Let's recalibrate. Nobody's perfect. We all know there's going to be hiccups along the way. And it's just a matter of how we kind of manifest it sometimes in our head, which once again does that cascade. So those are two of my favorite ways, that child's pose breathing, hands out, and then feet up the wall. Yeah.
What about after sitting all day? Is there anything that we could do to, one, I mean, we already said, right, holding all that tension in your belly, like letting your belly actually relax is so valuable. But if you're sitting all day and you can't necessarily change that, is there something that we could do at the end of a work day or midday even to help release maybe some of the tension there?
Yeah. So going back to the psoas is a muscle in the front of your spine that talks to the diaphragm. So your hip flexors, when you sit all day long, they get tight. You can go through some hip flexor stretches, or this is called the magic green ball in the Pilates world. That fascia that connects through the abdomen and through the back, through the hips, starts at the pelvic floor. So sitting on the ball gives you a little bit of a self-release, and then you can work up through the hips. You can roll to your tummy and get into your abs, get into that psoas. You can roll to your back and get your QL, roll down the hamstrings. Because this is a little bit less aggressive than the foam roller, usually your body's not as like retaliative and kind of cringes away. And I feel that for most people, we can do some breathing and releasing and wiggling and movement with kind of hit everything all together. And because you're moving, it's a little bit easier than like just laying there breathing. But this feels fabulous to get in some of those muscles that feel on.
Yeah.
And then kind of going back to I always like to do bridges with people where it's like move your little spine and get some segmental mobility. And if you can
breathe for a bit, turn yourself down, do some of those pelvic or the hip flexor openings, maybe sit on the ball for a little bit and just like find ways to add kind of all these things and get sort of that almost like 360 movement as well.
Yeah.
Through that space.
And turn it off to turn it on to, tight muscles or weak muscles in our world. So they're just a little less, they have less blood flow. So let's get some blood flow to them, make you feel better. And then sometimes just making them fire a little bit gives you that poise to stand up taller. But that's one of my favorites too. Otherwise, sneak around during the day, drop to your knee and do a hip flexor stretch. And every time you go potty, stop in the door and do a QL, like a side body stretch or a pec stretch. The more flex your forward, that chest gets tight. So then that predisposes you to that. But I love the habit stacking model because a lot of my patients are moms and we don't have a ton of time or business or allied health professionals. I find y'all find me. So whatever you can do to habit stack. So every time you go wash your hands, think, where's my pelvic floor? Where's my head? Like just check in with your posture. Every time you're in the kitchen, like what can you stack with that position or with that? Can you take 5 breaths? Can you, after you go potty, 3-4 times during the workday, can you pop into the door jamb and stretch that chest, side body stretch, touch your toes, do a couple squats? Or I love going back to your question earlier, just grab it onto the door jamb and then dropping down into that deep squat and letting your butt relax, but you're supporting yourself. So it's just an upright child's pose. It usually feels good. Now that's more hip flexion, but that really does open up those hips, and those usually get tight with that too. So the habit stacking thought was where I was going with all that, I think.
Awesome. Those are helpful tips. And then if you're feeling stuck, obviously go see a physical therapist yourself, because there is so much, I think the biggest takeaway really is there's so much personalization that can come into this based on your actual body and what's really going on, and a good assessment of how you move, and even just feeling of, your muscles and where they're at and what they're doing is such an important thing. So thank you for sharing all of that. And thank you for being on the podcast. Are you struggling with frustrating GI symptoms, gut issues, or maybe even IBS, and you really need support and guidance from a well-trained, qualified professional? If that is you, the Gut of 8 team of dietitians may be exactly what you are looking for. We personalize every plan for our clients based on their assessment, their medical history, and what actually is working or not working in their body. We do this through close follow-ups every 2 to 3 weeks, all virtual. We also do weekly check-ins on every single client, and we are available for our clients through email and messaging support throughout the week and their entire program. Imagine this to be that hand-in-hand care that helps you reach your goals more efficiently, but also with more confidence and knowledge that you can use throughout the rest of your life. If that is what you are looking for, you can start with a consult call where we can talk a bit more about your history, what you're looking for, what you need, and if we can help. You can find the link to schedule a consult call in the show notes if you are interested. We can't wait to talk to you, and we hope to work with you to help you reach your goals.